Hey, the road to good health is paved with good intestines. That's not mine. I know that's terrible. I shared that with a patient actually this week, and it was weird because of the phrase that it's the road to hell is paved with good intentions. So let's look at the intestines, because the road to our best health is truly paved with good intestines or good gut function. And I want to really connect the concepts of gut health to much farther reaching problems in the body, whether it's immune system compromise, whether it's the inability to lose weight, or what I deal with a lot, which is my great drawing over here of a joint and how we can stoke more inflammatory pain in our body and the structures of our joints because of what's going on in a remote destination or location, which is our digestive system. So if we jump into this section, we're going to talk about absorption, defense, detoxification, and elimination at a high level, okay? Because we need to understand this at a high level and not get lost in the weeds and the minutia of all this stuff, but we need to know the formula to reset and restore some balance in the gut so that good things happen elsewhere, because the gut really is the gatekeeper. It is the root or the floor of which we build up from our best health. So that's why I have this little teeter-totter. This balance in the gut is going to influence so many other things. Because if the gut is out of balance, well, then we can't effectively absorb nutrition. So this is a common scenario I see when people are pouring in what on the surface is the right nutrition. They're eating a lot of organic things, good whole foods. But the problem is they're not absorbing it, or maybe they're supporting their body even with a couple of good high quality supplements, but when we get testing, it shows them to be very depleted. Why is that? Because the gut, if we look at the gut, most people have heard the term microbiome. The microbiome is the trillions of organisms that live within our body, and they create this ecosystem. So it's bacteria, it's viruses, it's fungus. There's actually more of those cells. They literally outnumber our human cells within our digestive tract. And why is this so important? Because they will relay and control things based on the environment in our gut. So if our gut is out of balance, okay, the far-reaching effects, those chemical signals that are released from our gut into our bloodstream and remotely to other places, including our brain, there's something called the gut-brain axis. And developmentally, these structures develop very close to one another, and then they separated over time. Our brain to be up here, obviously our gut to be lower, but there's this super highway, this connection between them, that these chemical messengers are sent back and forth thousands and thousands of times per day. So what we're feeling in our mind or what we're perceiving in our mind could be, in fact, driven by what's going on in our gut, and vice versa. Have you ever felt really stressed? Maybe you had to get up and do some public speaking or record some videos in front of a camera. And when you did it the first time, you were a little uneasy, your stomach, you didn't feel like eating. What's going on there? You have a stress reaction in your system, which is our sympathetic system that drives like arousal in the body, meaning we're ready to fight and or flight, get the heck out of that situation. But we release some of these chemicals, the heart rate goes up, and what happens in the digestive system, because these two are interrelated and connected through those chemical messengers, is we start to change the chemistry in our gut, and our gut can turn. This is something that athletes can experience too. If they're really pushing it hard, you've probably seen some not so flattering meme pictures of people during marathons that had an elimination down their leg, right? Because their gut's just so under stress because of the mental and physical toll and the stress they're putting on the body, that these things fall out of balance literally, and somebody has diarrhea. So when we look at that at the high level, the influencing factors are going to be clearly what we put into our gut physically and the food we consume, but also how we're programming and filling our mind, what we're feeding that. Because those chemical signals if we're in this sympathetic aroused state where we're ready to fight and flight and go to war with people all the time, and that's going to put our body in a very different state than it needs to be for the digestive system to function at its highest level. Because our digestive system is literally a rest and digest kind of system. So that means the parasympathetic, the yin and yang for the sympathetic is the parasympathetic. So that's what calms us down. That's what mellows us out. That's what, when we get through a very stressful situation, you know, the nervous system, the other side of it, relaxes the body. And for the gut to be in balance and function at its highest level, we have to program our body to be more in that parasympathetic state than it is in that sympathetic state. And this has to go into how we approach our day and the things we allow to stress us. The physical amount of stress we put on our body. As I referenced before, people can not give their body enough recovery time and therefore it breaks down more. So when we look at it that way, how we're going to influence this has to do with our thoughts and how we feed things there, but also with the actual foods we're going to take in. So if we look at the things that are very good for our gut microbiome, most people alive today have heard of things called probiotics. Probiotics mean pro, good, and in relation to, say, antibiotics, which kill bacteria. Probiotics are good bacteria. This is what we call the good guys, the good stuff in the gut. So the probiotics are the good bacteria. Prebiotics, okay, so let's go back to probiotics for a minute. So can we get those from something other than a probiotic? Yes. There's plenty of good sources for those. If we looked at some types of fermented foods, whether it's miso or whether it's things like kimchi or things like sauerkraut, those will have some cultures in there of bacteria that are really good for the gut. And many people like yogurt or things like that that have also some bacterial cultures in there that could be good for the gut. As we'll talk about in a future lesson, dairy products may be problematic for some people in their gut balance. And the amount of good probiotic you get from most regular cups of yogurt or things like that, cottage cheese maybe, you'd have to eat dozens of cups to equal what you get maybe in a refined supplement probiotic. And we'll talk about that in the future. Where do I use supplements and why? But we can feed the body with good probiotics through the types of food. I'm going to give some handouts on that in this section so that you can see what those are. And then the prebiotics is the actual food for the good bacteria. So if these bacteria are to thrive and grow and this ecosystem is just like strong and bustling, we have to get the right foods in there. One of the biggest categories, if we look at what types of foods, is going to be vegetables, because vegetables have a high amount of fiber. And fiber is just a powerhouse thing for our gut health. And most people in their diet are very short on fiber. The target's 30 grams a day minimum for most adults. And so vegetable fibers, as they work themselves through the gut, literally get pulverized down by the mechanics of the gut and the enzymes and everything else that digest them. And then they become fermented. That's why some of those fermented or pickled things that are kind of pre-digested almost. So pickled foods and vegetables, things like sauerkraut, those type of things are really great for the gut because they're already kind of pre-digested in a form that those bacteria can actually eat a lot easier. It's like eating whole food versus putting it in a blender and having a smoothie. Well, the smoothie is kind of pre-digested, so our body does less work. And we may be able to extract things a little bit better from that, but maybe not. And again, it goes back to the gut balance. So if we have good probiotics in there and now we're feeding them with good prebiotics, well, then we got a really healthy system, a strong, robust system that should be able to now defend us, detoxify things as it comes into our system, and eventually out the other end of the chute, eliminate things properly. So when people are stopped up and they're constipated or they're diarrhea or they're kind of this yin and yang in their gut and they're battling, they have indigestion all the time, I tell people, man, if you're having reflux and things up here, if we looked at the pipes in your house, is it a sink problem or is it a pipe problem? It's most likely a pipe problem. So we have to go down and look at the pipes, because if we just keep throwing things in the hopper of the sink, as many people take with antacids and things of that nature, when they're having a reflux and indigestion, we're not going to get to the root cause. The root cause is further down the pipes in the system. So why is this so important? I want to connect the dots here, because we talked about the gut-brain axis, right? But I want to talk about the gut-joint axis, which is not a common thing that you see people talking about. Well, this is talked about all the time if you read enough functional medicine books and things like that. But the gut-joint axis is a big, big problem, because this is what's going to stoke that inflammation. And I'll give you an example. I had a patient that came to see me a few months ago, probably more like 6 now, and she had terrible knee pain, and she was convinced she needed stem cell therapy to fix her knee pain. She had done some researching. She said, hey, I don't want surgery. I don't want to live on meds. I don't want cortisone shots. I want something healthier for my body. So how can I use these cells in my body to help my body repair this weak link or this damage in the cells, in the structure of the joints? And when we started to work her up and we looked at her x-rays were normal for a mid-50s female. They looked fantastic. She had good joint space, good cartilage left here in the structures. But her knees were horribly inflamed, and the activity she was trying to do was inflaming her more. And what we figured out, or we're doing some workup and investigation, is that she had some digestive issues. We fixed that. She had some nutritional gaps. We fixed that. We eliminated some things in her diet that were likely inflaming her. I'm going to get into that a couple sessions deeper. And over a couple of months, the knee pain went away. So she didn't need this aggressive treatment for her knees. What she needed is a reboot of her digestive system and really what I'm going to talk about now, the immune system. Because in the gut, if we look at the small intestine or the gut as a whole, but the small intestine is called small because it's small diameter, okay? Our large intestine, the small intestine is about 80 to 90% of the total length of our digestive system, but it's small in diameter. That's where it gets its name. The large intestine is larger in diameter, larger caliber, but it's a short section of the total digestive system. So if we look at the small intestine, so your gut pulverizes things in the stomach, chews it up, like breaks it down, but there's not a ton of absorption. Yes, we get some there, but as things move into this small intestine section, this is where the body starts to pull things apart, break your food down to smaller and smaller particles that can be digested and absorbed through the cells into the bloodstream, where the bloodstream can then shuttle it to all the individual cells of the body, whatever tissue that may be. And all of our tissues need nutrition in the proper amounts. So why is this an issue? Because if we have a gut issue here, and our gut is not in a good state of balance, and I blew this up here so it'd be a little bigger so we can discuss this, but if our gut is taking food in through the digestive system, we're breaking these things down, right, from a large piece down to a very small piece that can slip across or through these cell junctions into the bloodstream. Well, what happens if the gut looks like this? So if the gut starts to break down, get these giant gaps between the cells, okay, because there's inflammation in the gut, right? Now we have these channels moving through, and this is what we call leaky gut. Why is this important? Because if our food's not properly digested, or if this barrier of defense in our gut isn't there to protect us from things that can get into our body, and I'm talking about, say, chemicals in our food additives, preservatives, things that can be, they're foreign, they're synthetic things, and they're going to agitate the body. But our body can usually deal with those with a strong gut, pass them through, detoxify, protect our body, and eliminate them. If we have a leaky gut situation, well, now those things, or bigger particles of undigested food, can slip right through here into the bloodstream, which in part is the immune system. And it's estimated that between 70 to 80% of your immune system is intertwined with your gut. Why is this important? Because as these bigger particles or toxic chemicals or things slip through into the bloodstream, where your immune system is taking a look at it to see, is this thing harmful or helpful to me? Is it potentially threatening? If it sees it as potentially threatening, it's going to mount a massive inflammatory reaction to sequester that thing, to try to detoxify and bind it up and try to get it out of your system. But the problem here is this is in the bloodstream. It's not locked in here in the interior of the gut where it's kind of contained. even though, as I talked about, that gut's a long stretch. So if it's in the bloodstream, it's going to go everywhere. So if we're mounting this giant inflammatory response to things like a bunch of foreign chemicals that are maybe in our food products, or even chemicals that are entering the body a different way, say through our skin, we're still going to have this interplay with our immune system in the bloodstream. We can prime this inflammatory reaction. And simply these undigested particles, if we're not properly digesting and breaking our food down thoroughly, these undigested particles of food are going to trigger this inflammatory response. And where that blood goes, it goes everywhere. So what about the blood vessels now that feed the joints here, the tissues around the joints? That same inflammatory response is going to amplify the response here. So if we have inflammation in our joints from a process, as that woman was dealing with, I think because just putting more stress on her joints, she was inflamed, but she had this going on, so she stoked up the inflammation, it's going to get worse. And it may throw us completely off track because we're looking here to solve the problem, but the solution is really here, the gut and the immune system. So again, why is this important? Because what can trigger this leaky gut situation is stress. So as I started the story with, when we feel really stressed and our gut's kind of in knots, if we're under that stress for a long enough period of time, we break this gut down, okay? If we are put on something like antibiotics, as I mentioned, they're gonna kill some of the good probiotics, disrupt this balance, weaken the gut barrier of defense and that integrity, and that's gonna cause a problem. If we have imbalanced gut bacteria, so sometimes people will get something called a dysbiotic bug, dysbiotic, like dysfunctional and destructive, and this could be a bacteria that shouldn't be there. This could be an overgrowth of yeast. This could be a parasitic infection. I find those sometimes when I test people. All of those can inhibit or shift the balance into a negative balance and create this dysfunction of the gut, create this leaky gut. And I mentioned toxic chemicals, and I'll get into medications because a big one in my arena is NSAID medication. Non-steroidal anti-inflammatory drugs. What do those do? They suppress inflammation, but they're very harmful to the gut. They inflame the gut. And some people know if they take too much of those things, they can break down their gut and get ulcers and get bleeds and get things like that. But what they do a very effective job of is disrupting the gut balance, the chemistry, the acidity, the enzymes that are in our gut. They start to goof that up. And so NSAIDs are a big one for people that are taking them for joint. They're indirectly causing collateral damage here in the gut. So why is this important? Back to the joint, because as this inflammation is stoked through this process, okay, from the food we take in, to the gut being in imbalance, to a leaky gut situation, to where we're priming this inflammatory reaction that moves through the bloodstream and affects joints at a distant location from the gut due to that bloodstream inflammation. The things that start to elevate here are cytokines. Those are inflammatory chemicals, as I mentioned, these chemicals that are talking in our body. Fun things like MMPs, which is called matrix metalloproteinases. So there's a matrix within this cartilage. If we blew it up, it'd be like strings of collagen and these other bigger particles. But we start to get more inflammatory particles in and around the joint, because the joint surface, when people think about cartilage, they think about just like rubber on a tire, like we wear it down over time, and that's what arthritis is. But it's as much a chemical process when people have arthritis. So when we're stoking this fire and growing this inflammation, and it's targeting in our joint, and it's driving up those MMPs, it's driving up those cytokines, and it's driving up some destructive, what we call proteolytic enzymes. There's destructive enzymes. There's also proteolytic enzymes that are actually beneficial for us because they help us turn over tissue and repair it. But the big thing there is if we keep driving that up all the time, we're going to chew this joint up faster. And that's where then people hurt more. And conventional approach would be to shoot steroids in their joint, and steroids destroy the joint even more. They're actually toxic to those cells that we're trying to save in the joint cartilage. If you put more than 5 milligrams in there, doses higher than 10 or cumulative doses, and most people get 40 to 80 milligrams, it will break down the cells in the joint very effectively. So it's a great solution, we'll call it in conventional medicine, like I was trained in, and to put steroids in there and calm the inflammation. But what it's going to do is act as another accelerant. So now you have this process working against you, driving more inflammation into the joints or muscles or tendons. We're talking about musculoskeletal pain and problems. And then we put something like NSAIDs on board. We destroy it even more. And then we shoot steroids in the knee. And so we have these stacking effects of things that are now cumulatively causing more damage in that joint and more damage in your body. So the focus goes back to the balance of the gut, because Alessio Fasano is a pediatric gastroenterologist, and he's credited with a lot of this work on leaky gut. And I love a quote that I saw of his, because he said, the gut is not like Vegas, okay? What happens in the gut doesn't stay in the gut. It has this far-reaching, influencing impact on systems of our body. And we're talking a lot about joint health, but the same goes for endocrine health. So if our gut's out of balance, our endocrine system, which controls our hormones, which controls, say, our thyroid or estrogen, progesterone, or things like that. So if people are really struggling and they feel like everything else is dialed in pretty well, but they can't lose weight, or they have low energy, they have all these issues, again, this gut is really that gatekeeper to all those other systems. So we can cause a lot of dysfunction very quickly if this is an imbalance. So the take home, again, the road to good health is paved with good intestines. We're going to give you some exercises. We're going to give you some sheets to look at. How do you restore gut balance? What can you do with probiotics? And I'm talking about foods and prebiotics. We're talking about foods. But then if you are to select probiotics, what does that look like? What types should you use? And some of that we can now get testing. And we'll dig deeper into this in week 4 as to how do we deeply look at this and see what's goofed up with your system. More importantly, how do we restore the balance? And how do we have it really targeted and individualized for you? So that's a deep dive on your gut, the gut-brain axis, the gut-joint axis, and how it can have far-reaching impacts on your body's ability to absorb, defend, detoxify, and eliminate, but also far-reaching impacts on other systems of your body.